So I work for a large casino in Nevada, and one of the ways that we communicate is our CEO has a YouTube channel, and he just put out a video in regards to the vaccine and being vaccinated, and we had to fill out a survey whether or not we are willing to be vaccinated. Anyways, one of the things that he says, well, I'll show you the little clip of the video, but he gives us some websites to reference to get valid information to make the most informed, educated decision on whether or not we want to be vaccinated. And I'll read to you what I found on those websites, but here's a clip.
There are those people who have some serious medical conditions to contemplate, maybe about allergies, but there are answers for these questions. And what I really want to do is I want you to get information from medical sources. I want you to get information from people who are in the profession of providing guidance. Okay? If I have a real serious issue, Angela and I can't figure out something, and we need to figure out something about the plumbing, we go to a very expert plumber to get that information. If it's about electrical, I get the guidance of an excellent electrician. So when it comes to medical, I want you to get information from medical providers who are experts in the industry. Okay? We have put all of the links to the CDC, to the Journal of American Medicine, Johns Hopkins Medical Center. A lot of you know my dad is a doctor, and I grew up with a lot of pride in my dad's excellence in what he did. My dad was excellent in his craft. And as a result, he was a teacher, and still at the age of 84 is out there trying to help young doctors. And so I'm passionate about the capability and competence of great practitioners of medicine. So please make this decision by getting information from experts in the medical profession. Because this decision doesn't just affect you. It's going to affect people around you.
So this is the email that I got, and with all the links here that my CEO provided for us. And I just went ahead and started from the top with the CDC. So that lasts longer: immunity after getting COVID-19 or protection from COVID-19 vaccines. Answer: according to the CDC, the protection that someone gains from having an infection is called natural immunity. Varies depending on the disease, and it varies from person to person. Because the virus is new, we don't know how long natural immunity might last. Current evidence suggests that getting the virus again, reinfection, is uncommon in the first 90 days after the first infection with the virus that caused COVID-19. We won't know how long immunity lasts after vaccination until we have more data on how well COVID-19 vaccines work in real-world conditions. That was the long answer. The short answer is they don't know. They don't know. Next question. What percentage of the population needs to get vaccinated to have herd immunity to COVID-19? Experts do not yet know what percentage of the people would need to get vaccinated to achieve herd immunity. And again, it goes on and on and on and gives you a long, fancy, drawn-out answer for I don't know. They don't know. They don't know. Who is paying for the COVID-19 vaccines? Vaccine doses purchased with U.S. taxpayer dollars will be given to the American people at no cost. So you are. That's the answer. You're paying for the vaccines. So how is the CDC making COVID-19 vaccine recommendations? Well, when the Food and Drug Administration authorizes or approves a new COVID-19 vaccine, the Advisory Committee on Immunization Practices quickly holds a public meeting to vote on whether to recommend the vaccine based on input from ACIP. CDC then publishes vaccine recommendations in the Morbidity and Mortality Weekly Report. It's a weird place to put that, right? ACIP and CDC are also making recommendations for who should be offered the COVID-19 vaccine first when supplies are limited. While the CDC makes recommendations for who should be offered the COVID-19 vaccine first, they do not enforce their recommendations as policy. If I have already had COVID-19 and recovered, do I still need to get vaccinated with a vaccine? Yes. Due to severe health risks associated with COVID-19 and the fact that reinfection with COVID-19 is possible, you should get vaccinated regardless of whether you've already had COVID-19 infection. If you were treated for COVID-19 symptoms with a monoclonal antibodies or convalescent plasma, you should wait 90 days before getting a COVID-19 vaccine. Talk to your doctor if you are unsure what treatments you received or if you have more questions about getting a COVID-19 vaccine. Experts do not yet know how long someone is protected from getting sick again after recovering from COVID-19. The immunity someone gains from having an infection, called natural immunity, varies from person to person. It is rare for someone who has had COVID-19 to get infected again. It is also uncommon for people who do get COVID-19 again to get it within 90 days of when they recovered from their first infection. We won't know how long immunity produced by vaccination lasts until we have more data on how well the vaccines work. Both natural immunity and vaccine immunity are important aspects of COVID-19 that experts are working to learn more about. So again, they don't know. Do I still need to wear a mask and avoid close contact with others if I have gotten 2 doses of the vaccine? Yes. What? Why? Okay. Not enough information is currently available to say if or when CDC will stop recommending that people wear masks and avoid close contact with others to help prevent the spread of the virus that causes COVID-19. Experts need to understand more about the protection that COVID-19 vaccines provide in real-world conditions before making that decision. Other factors, including how many people get vaccinated and how the virus is spreading in communities, will also affect this decision. We also don't know yet whether getting a COVID-19 vaccine will prevent you from spreading the virus that causes COVID-19 to other people, even if you don't get sick yourself. So even after you get the vaccine, you can still get other people sick? What the fuck? Are COVID-19 vaccines safe? All the COVID-19 vaccines being used have gone through rigorous studies to ensure that they are as safe as possible. Systems that allow CDC to watch for safety issues are in place across the entire country. The U.S. Food and Drug Administration has granted emergency use authorizations for COVID-19 vaccines that have been shown to meet rigorous safety criteria and be effective as determined by data from the manufacturers and findings from large clinical trials. Clinical trials for all vaccines must show they meet rigorous criteria for safety and effectiveness before any vaccine, including COVID-19 vaccines, can be authorized or approved for use. The known and potential benefits of a COVID-19 vaccine must outweigh the known and potential risks of the vaccine. Now this one, guys, just pisses me off. Is it safe for me to get a COVID-19 vaccine if I'm pregnant or breastfeeding? People who are pregnant and a part of a group recommended to receive the COVID-19 vaccine may choose to be vaccinated. If you have questions about getting vaccinated, talk with your healthcare provider. A talk with your healthcare provider may help you make an informed decision. While breastfeeding is an important consideration, it is rarely a safety concern with vaccines. No data are yet available on safety of COVID-19 vaccines in lactating women or the effects of mRNA vaccines in breast milk. mRNA vaccines are not thought to be a risk to breastfeeding infants. People who are breastfeeding and are part of a group recommended to receive a COVID-19 vaccine, such as healthcare personnel, may choose to be vaccinated. To make sure that more information is gathered regarding the safety of these vaccines when administered during pregnancy, pregnant people are encouraged to enroll in vSafe CDC's new smartphone-based tool being used to check in on people's health after they receive the COVID-19 vaccine. If pregnant people report health events through vSafe after vaccination, someone from CDC may call to check on them and get more information. Additionally, pregnant people enrolled in vSafe will be contacted by the CDC and asked to participate in a pregnancy registry that will monitor them through pregnancy and the first 3 months of infancy. So again, the answer is they simply don't know. But also, they are making assumptions. They're assuming, but the fact is that they don't know. They don't know the effects on pregnant women. They don't know the effects on a baby that's drinking breast milk. They want you to be the guinea pig and let them know how it goes. So, because I'm such a good employee, I listened to my CEO and I went to the first website, open-minded, and willing to take in the information and make a sound judgment. And I gotta be honest with you, after this first website, I think I'm more confused, or I guess, yeah, a little more confused. Why in the world would anybody take an experimental vaccine that literally they don't know how long it's going to last, they don't know how well it's going to work? It will not change the fact that you have to be masked and distanced, and it doesn't prevent the spread of the virus. What then is the point? I have to wonder if my CEO went and read this information himself, because I feel like this information, first of all, didn't give any answers like he said it would. The thing that I know now is that the answer is they don't know to most of those questions. They don't know. They don't know. They don't know. They won't know until enough people have signed up for this experiment, and they can get answers from you, the guinea pigs. Maybe the second website will answer questions a little better, and convince me to get a vaccination. Let's go check it out. Okie dokie, so the second link was to Johns Hopkins frequently asked questions, and from the top, here we go. How long will protection last following vaccination? We do not know how long protection will last following vaccination, but it will be critically important to measure long-term protection at least 2 years in the phase 3 trials and in other groups prioritized for early vaccination. We are still learning about the duration of protection following infection with SARS-CoV-2, and it is too early to tell how long the protection will last. There have already been cases where individuals have been shown to be infected twice, but most often the second illness was mild or without any symptoms. This is what we would expect with an immune response that protects against disease but not infection. So they don't know, just like the other guys. If I already had COVID-19, should I still get a vaccine? Well, when people recover from some viral infections, such as measles or mumps, they are protected against reinfection and would not need to be vaccinated. However, for others, diseases such as pneumonia or influenza, it is important to be vaccinated or revaccinated despite having the disease, because the vaccine protects against several strains or types of the pathogen, and thus can still be valuable. There is no evidence that there are significant differences in SARS-CoV-2 to warrant vaccination for this reason, but we do not yet know how long people are protected after having COVID-19, and so do not know yet if these people should be vaccinated. The CDC said yes, you should be. Anyways, if protection only lasts for several months, vaccination could be of benefit. Okay, but we don't know, is the answer. Not yes, we don't know. Okay, can someone get COVID-19 from the vaccine? No, it is not possible to get COVID-19 from vaccines. Vaccines against SARS-CoV-2 use inactive virus parts of the virus, the spike proteins or gene from the virus. None of these can cause COVID-19. Should I get the vaccine for influenza, the flu shot? Yes, it is very important to get the influenza vaccine, particularly this season when both influenza viruses and SARS-CoV-2 will infect people. We still do not know how these two viruses will interact, but people can get infected with both viruses, and this will likely cause more severe and disease and possibly death, reducing the number of people who get severe influenza, blah, blah, blah. Anyways, will we still need to wear a mask and practice physical distance once the vaccine is available? We will still need to wear masks and practice physical distancing until a large proportion of the population is vaccinated, and we are sure the vaccine provides long-term protection. Initially, we will not have enough vaccine to vaccinate everyone who wants the vaccine, and the virus will still be transmitted. Although the phase 3 clinical trials are designed to determine whether vaccinated individuals are protected against disease, it will also be important to understand whether vaccinated individuals are less likely to transmit the virus. Wait a minute. So we're in the phase 3, we are the phase 3 trials, I'm pretty sure is what they're saying, and they don't know if it protects against the vaccine or is still transmissible. Again, what is the point of getting this fucking experimental vaccine? Anyways, so This is likely but not ensured if a vaccine not only protects against disease but reduces transmission, and it continues to do so for many years. We are likely to reach a state of herd protection when masks and physical distancing will no longer be required. Wait a minute. It is likely not ensured if a vaccine not only protects against disease but reduces transmission and continues to do so for many years. We are likely to reach a state of herd protection when masks and physical distancing will no longer be required. Many years? Are you crazy? Herd protection is achieved when a sufficient proportion of the population is made non-infectious through vaccination. Boo. Do you have a list of good vaccine resources? Why, yes, they do. So the second website just kind of further reiterated that they don't know is the right response to most of it, because the Johns Hopkins website had conflicting answers with the CDC website. One thing they said was, if you have already had the illness, do you need to get vaccinated? The CDC said yes. Johns Hopkins said probably not, but they don't really know for sure. Yeah. So, and then masking, the Johns Hopkins said that if we figure out a vaccine is doing good after several years, then masks can come off and distancing can stop. These people are crazy if they think that this is going to last several years. It's already been a year, though. We're going on year 2. Ridiculous. Johns Hopkins also did reconfirm that they don't know whether the vaccine will stop transmission. They don't know whether the vaccine will prevent illness. And you can't take your mask off. You can't not social distance. So literally, again, why would you take an experimental drug if it literally has no benefit? So the next resource on the list was from the JAMA network, and I went here and there was really nothing about vaccines except for a couple of articles. So here they are. From December 14th, 2020, behaviorally informed strategies for a national COVID-19 vaccine promotion program. National efforts to develop a coronavirus disease 2019 vaccine at warp speed will likely yield a safe and effective vaccine by early 2021. However, this important milestone is only the first step in equally important challenge, getting majority of the U.S. public vaccinated. In a September 2020 survey of adults, only 51% indicated that they were definitely or probably willing to get vaccinated with a COVID-19 vaccine. 25% reported that they probably would not get the vaccine, and 24% reported that it is unlikely that they would be vaccinated. This survey further revealed that acceptance was lower among the Black individuals, those with lower education attainment compared with college graduates, or those with postgraduate education among Republican voters. The U.S. needs a national strategy for promotion of COVID-19 vaccines that utilizes the urgency and commitment of the Operation Warp Speed with innovative behavioral science and social marketing approaches to increase COVID-19 vaccine confidence and acceptance in diverse populations. Core to any successful strategy is to rebuild trust in the rigor of vaccine trials and the integrity of the approval process. Literature on vaccine acceptance identifies some essential strategies: simple, easy to understand language, messaging that emphasizes science over politics, endorsements by diverse and well-regarded celebrities and opinion leaders, and emphasis on facts and evidence over myths and disinformation. For the COVID-19 vaccine, attention must be given to rebuilding trust in communities that have historically experienced medical exploitation, unconsented experiments, and social economic marginalization. Those getting vaccinated also need to be warned about the transient adverse effects of vaccines to avoid negative press. Make access to valued settings conditional on getting vaccinated. Many retail outlets and restaurants have made face coverings mandatory for the protection of employees and other customers. In a similar way, access to certain settings could be made conditional on receiving the COVID-19 vaccine. healthcare clinical settings, with the exception of individuals presenting acute illness, cog- cog- congregate living facilities such as nursing homes, colleges, and dormitories, kindergarten to 12th grade schools, workplaces, particularly for large employers and settings where employers interact with the public, retail, grocery, and public institutions. Individuals could also be required to show proof of vaccination to enter stores, movies, and in-restaurant dining, amusement parks, gyms, bars, and other public places with substantial risk of transmission. Qantas Airlines, for example, reports that it and other airlines are considering making vaccination a condition for international travel. These approaches could provide a strong incentive to get vaccinated. The degree of acceptability of these approaches will depend on the public's perceptions about COVID-19 by the time vaccines are widely available. A long winter of new cases, overcrowded hospitals, and more than 2,000 COVID-19 deaths per day may shift perceptions of what is politically acceptable. Employers can legally mandate vaccination as a condition for in-person work, provided there are exceptions for concerns related to disability and religious beliefs, and reasonable alternatives to continue to work for those who refuse vaccinations, such as at-home working. Use public endorsements from trusted leaders to increase uptake. Once initial high priority groups like healthcare workers receive the vaccine, states and cities could preferentially allocate the vaccine to employers contingent on leadership publicly vaccinating as an example for employees. This is an example of what psychologists would call credibly enhancing display, whereby CEOs and other corporate leaders would visibly set the example for their employees. Engaging in a recommended behavior is far more effective in convincing others than simply recommending. True. Recommending Engaging in recommended behavior is far more effective in convincing others than simply recommending that behavior. It may also be useful for trusted national leaders representing diverse demographic groups and political parties to get publicly vaccinated. The announcement by former presidents Bill Clinton, George W. Bush, and Barack Obama of their intent to get vaccinated on camera is a good example of this. Provide priority access to people who sign up to get vaccinated before vaccines are widely available. This strategy leverages the power of pre-commitments and shifting social norms in favor of getting vaccinated by highlighting the likely scarcity of vaccine doses in the early stages of distribution. Marketing research has shown that people tend to covet items that are more difficult to obtain or that they perceive others as being able to access first, particularly during the period in which the new product is introduced. Transform individual vaccination decisions into a public act. Several approaches could be useful to signal vaccine acceptance. Strategies used to promote voting, i.e., I voted stickers and social media testimonials of voting, and blood donation, I donated pins and coffee mugs that signal donor status. People often take their cue of how to behave from the behavior of others, and social accountability, how others view a person's actions, could be an important motivator. Social factors can also be leveraged by city and state health departments, civic organization, and employers promoting the community benefit of vaccination. People who might not do something for themselves will often take that same action to benefit others. Implementation considerations. The rollout of a COVID-19 vaccine comes at a unique time. The credibility of the Centers for Disease Control and Prevention has been undermined, and a new presidential administration will transition into power. And the U.S. is entering the third surge of cases. Initially, supplies of vaccines will likely be sharply constrained. In this period, adherence to non-pharmaceutical interventions such as masking and social distancing will be critical. To this end, it will be important to frame the vaccine as part of a comprehensive pandemic response versus the sole savior strategy that will result in a return to normal life immediately, which could lead people to take greater risks than they should the prospect of an effective vaccine not exist. Given the importance of moving quickly, a national entity similar to Operation Warp Speed is warranted to steer federal COVID-19 vaccine promotion efforts. This entity should include scientists from multiple disciplines such as epidemiology, vaccine science, behavioral science, social marketing, and communications, as well as vaccine program delivery experts. The team the team should represent a spectrum of political views to depoliticize the pandemic response. It would be helpful if this entity could have significant decision making and resource allocation authority to develop a national social marketing campaign, disseminate vaccine promotion and service delivery guidelines for implementation by local immunization programs, and provide training to physicians in communicating with patients about vaccination. In a recent viewpoint, Goodman and colleagues provided answers to what are likely to be common questions patients ask about their clinicians about the vaccine. The development and distribution of a safe and effective COVID-19 vaccines will be an extraordinary achievement. Vaccine acceptance must start with transparent safety and efficacy data. Hopefully, both the Advisory Committee on Immunization Practices and the FDA Vaccines and Related Biological Products Advisory Committee will support the decision of the FDA regarding approval of any form of vaccine. However, the potential for these vaccines to help the pandemic will be limited. Then this is the other article that I found with COVID-19 vaccine in the title, maximizing the uptake of a COVID-19 vaccine in people with severe mental illness. And it's like 9 pages, and it just goes on and says that this is one of their priorities. Mentally ill people, Black people, Indigenous people, these are the people that they want to vaccinate first. And these are the people who are most apprehensive because they have had the worst history with these medical professionals. So after careful review of the information recommended to me, I have decided that there's no way that I'm getting vaccinated. Not until there's some really good answers with some really positive outcomes. Yeah, right now, this is an experiment. Anybody who's getting vaccinated right now is literally signing up to be one of their guinea pigs. Thanks, guys.